Hello, I'm Janet Butler, the CEO and President of Community Systems, and I wanted to reach out because I think we're all concerned with a number of things that are happening politically in our country, and a number of issues that are out there surfacing now, or not surfacing, knocking us over, really have the potential to influence the supports that we give to people. And we need to stay on top of that. And I would like to make sure that we're keeping people informed. We're letting you know we're thinking about things. We're very concerned with where the funding sources, et cetera, for our supports are going. And we are going to be a unified front to be able to make a difference. So what I want to talk some about is what are the potential changes, what are the potential concerns that come around after President Trump's big, beautiful bill that was passed on July 4th. For the service industry that helps to support people with disabilities in the United States, this is a big, ugly bill, and it is now law. CSI is not going to try to recreate systems of advocacy. We're not going to try to recreate a lot of the information, etc., because there are other organizations that do that as a primary focus, and they do it really, really well. That would be ANCOR, that would be the ARCs in your area. Those are the people that if you get on their mailing list, you will get the updates and that information. And what's important with that is very often it is with calls to action. And those calls to action make it very easy for you to enter your name, your address, and get your message out there to elected officials a lot easier than if we were out here trying to do it independently on your own, searching who you should be calling, how do you get in touch with them, etc. So as those messages come through, as we are sharing them as an organization out there to families, to staff, you need to then go ahead and share it with 10 more people, because the more people that respond and the more people that act and have a voice, the more likely we are that we can influence what's coming down the pike. So one of the big things that this big, beautiful bill is attacking and devastating is the Medicaid system. And for those of you who don't know, almost all of our funding comes from Medicaid. We have two different ways that Medicaid covers the people that we support. The first one is with anyone else, the income-based, it's the health insurance. So that Mass Health, there's other names for it in different states that pay for the medical bills, etc., of the people that we support. The second part of it is Medicaid waiver programs, and that's how the actual funding is passed on to community systems for our supports. What is concerning is in each state, when it comes to Medicaid, 50% of every Medicaid dollar comes from the federal government. 50% comes from the state government. Currently, CSI is a $113 million organization. It is amazing to me that that's where we are, but it is what it costs to support people. We're very proud of the fact that the majority, all but about 9% of every dollar that we have is dedicated to direct supports. It's either paying for housing, it's paying for staff, food, utilities, etc. Our administrative costs are very, very low. And given the hierarchy and the advanced leadership that we supply at CSI and the expertise, the fact that we can do that and keep our administrative costs low is amazing, but it is also a commitment because we wanted that money going where it needed to be. So when you look at that, then over $50 million, about $56 million of the money we get filters to the states from federal money. That is why this is a really serious bill, and this is something we need to all stay on top of. In the past, many of us have been part of advocacy movements, speaking out, showing up, protesting, calling, etc., and it has made an impact on the state budgets, and it's made an impact on federal budgets. This is where we need to listen and we need to act. Not just reading it, not just hearing it, we need to act. So when there's a call to action from the ARC, when we're sending you out something saying you need to reach out to your elected officials, you need to get this message across, we all need to do that. Because when you look at CSI has 1,200 employees, CSI has 600 people that we support and their families. If you look at that, in each of those 1,800 people have 10 people in their world that could potentially be out there and make a difference, that is a lot of people that are calling, that are reaching out to elected officials to say, hey, what's going on is wrong. Hey, what's going on is going to support my son, is going to influence my son, my daughter, other people. The difference of 5,000, 6,000 people calling, emailing, showing up versus just a few stragglers has an impact when you're asking for change. So one of the biggest things I'm recommending out of this video is pay attention to what's going on, act when you're asked to act, and move forward. Be a voice. The other part of that is be a voice to the elected officials to let them know we're out here. Do you know elected officials in your world? State level, federal level. Many people don't know we're in their back door. Many people don't have any idea there might be a group home on the same street that they live on. When you introduce them to the people that we support, to your sons and daughters, etc., it is very different to be standing there in a group home, seeing the excellent care, seeing the services, seeing the resources, and how they're used so well for many people that are really, really challenged. It can make a huge difference. CSI supports some of the most challenging folks in all 4 states we operate. Whether it's medically challenged, folks with really significant medical needs, or whether it's behavioral and psychiatric challenges. We are not known for supporting folks whose lives run very smoothly. We do a lot of work to help people with real challenges become adapted and truly a part of their community. It is why it is so important that we maintain our funding and we're able to do that. So what I think is going to happen is I think we're going to be a certain level of collateral damage in that eligibility and things like that for the Medicaid programs, for health insurance, for food stamps, for SNAP and everything is all going to change. And it may be some of our employees are affected by that change. It may be the people that we support. Those are the people we're going to have to rally around and figure out how to keep them safe, how to keep them so that they have great lives in their world. So when we think about that, we as an organization owe each person we support a commitment that we're thoughtful about these things and that we're planful about it. When we lived through the pandemic, many organizations had plans for what happens when people get sick. That was not CSI's approach. Our approach was people only get sick if they're exposed to the germ. So we're going to prevent people from being exposed to the germ so they don't have to get sick, so people don't die. And because of that, our approach was very, very different than other agencies. And our approach was very successful. A lot of people thought we were a little crazy in the beginning, but it really proved to be the way to go. And we need to do almost the same thing when it comes with this funding. We just started our fiscal year 26. July 1st is our Happy New Year. And we went into it with budgets this year that were very cautious, that were very deliberate, that said we need to leave a cushion of money that can be used for many things for the people we support, but we know is sitting there that we're able to use. Should something come down the pike that is a small change or something like that, we need to be prepared. We're not going to see increases. We don't see a lot of increases for cost of living over the years, but we're not going to see any. We're going to see reorganization. We're going to see things and how people are approached and how systems run change. We're going to have to stay on top of it. We're going to have to stay cooperative, etc. One of the things I'm very proud of is many nonprofits run as charities, and they run as charities in that they spend what they get. They do that. They rely on just donations a lot of times and things like that. CSI has always had a very thoughtful business approach that said, we have a mission, we live by that mission, but we also are a business, and we have to build very strong fiscal stability. And we've weathered storms over the last 40 years because of that. We've made sure at the end of the year, we're building net assets. We're building that fund that says, should funding stop for 2 months, 3 months, we'd have the cash flow to be able to keep meeting payroll, to be able to keep paying our bills, etc. We need to tighten our belts now. We need to make sure that we're really staying on top of that. We also need to plan, and we're in the process of planning, what happens if someone came back and said, we're going to cut 10 or 20% of what your funding is. 10 or 20% sometimes doesn't sound so scary. 10 or 20%, if it is 10 or $20 million, is a lot of money. And we need to be prepared to say, how do we keep sound services and still be able to do that? And the other thing we have to have in our little file cabinet is, and what will we do if there are catastrophic cuts? Hopefully that never happens, but I think we have a good approach that if we had to, we can weather that storm. It's a different approach. It's not living being driven by mission. It's living being driven by health and safety, as opposed to staffing patterns where, you're making sure everybody's getting out every day. We're doing a lot of things like that. We really would be focused on people are healthy, they are safe, we're able to maintain that. The only place we really have to cut any funding, etc., is out of staffing. Because if 70 to 80% of our funds are going to direct staffing for people we support, that's the only place you play with. So those catastrophic cuts would be where we used to have 2 people in a group home with 4 folks. We might only have 1 staff person around the clock. Changes our outlook on life, but it keeps people healthy and safe. Our protocols change, our oversight changes. So we have a plan at this point that is, if we just have some things that are going to morph, there's not going to be increases, we're going to struggle with increases in inflation, etc. We have a plan that we can do that. We have a plan that if they come in and they cut 10 to 20% of our revenue, we can do that. If catastrophic things happen, we can do that. We can have a plan that can get us through that. It's not who we want to be. It's not where we want to go, but we are prepared for that. And folks need to know we are watching this every day and we're taking it seriously. So going forward, you need to stay informed, you need to listen, and you need to act. You need to embrace that you have a voice and that we, as a large voice, can influence this. So reach out if you have questions. Reach out at the state levels. Reach out to me if you would like. We're going to try to get a lot of emails out, not saturating people, but at least every few weeks, videos or emails to say, this is what we're hearing, this is what's going on, because it's very different state to state how they handle it. It's very different in a federal government that is very often mandating things, pulling back, mandating, changing. We just have to stay on top of this, and we have to stay thoughtful. And I think one of the best things is to stay informed, to talk about it, and to keep people in the loop. So That's my message for today. I deeply appreciate you taking the time. If you have any connections, you want to reach out, people that we can meet. Virginia is forming a parents group of advocacy that is across a number of agencies. We have a lot of opportunities for people to act and to be heard. So look at our advisory committees, etc. But reach out if you have connections and you think it would be helpful if you have our support. Thank you, and thank you again for trusting CSI to be the provider in your world.